Well, it's important to restrict the use of antibiotics because we want to minimise the misuse of these drugs, particularly for viral infections. We need to discuss with patients that self-care is beneficial in non-severe cases, which can be resolved by self-care themselves. We should recommend starting treatments first with over-the-counter medicines and first-line antibiotics if needed for bacterial infections, and antibiotics only if needed for severe conditions like pneumonia and TB. And in these cases, pharmacists have an essential role in monitoring adherence. Directly observed treatment initiatives in India, where pharmacy is supervising the patients, have shown massive impact on patient care. Well, FIP aims to support AMR and to reduce AMR in several ways. The first is about policy. It's key, and FIP statements on policy and our reference documents provide a clear set of guidance for policymakers. Secondly, campaigns and visibility is also key. AMR Awareness Week, supporting WHO in implementation of some of their policies and their campaigns, the AMR Action Plan, technical support to WHO. Thirdly, support for pharmacists across the world. FIP contributed to the AMR Competency Framework and AMR Curriculum, and these are new projects with AMR treatment. Fourthly, advocacy and promotion of the messages and impact at international conferences and platforms. In these 4 ways, FIP can make an impact. Well, we know that one single approach can work, but it will have a limited impact. Therefore, FIP seeks to work across the 4 areas mentioned before: domains of policy, campaigns and visibility, support and advocacy to maximise our impact, individually, nationally, regionally and globally. Teaching future generations at universities supports individuals at the very start of their career. Working with WHO and partners ensures we have a global impact. Well, we know pharmacists are ideally placed to restrict the use of antibiotics to appropriate conditions. Firstly, by promoting self-care. Secondly, by deprescribing. Thirdly, by prescribing by pharmacists, for example, with upper respiratory tract infections, urinary tract infections, chlamydia in UK and Australia. And fourthly, by promoting adherence to medicines regimes.